The infectious disease that I researched was hepatitis A, B, and C. Hepatitis A is transmitted through oral fecal contact, crowding, poor sanitation, contaminated food, or water. All the signs and symptoms for hepatitis A, B, and C are the same, so I'm only going to talk through them once. So the signs and symptoms is a high fever, where two out of three of the cases are usually asymptomatic. Week two to about 6 months of incubation is marked by specific signs and symptoms such as malaise, fatigue, upper respiratory infection, anorexia, nausea, vomiting, mild abdominal pain, and headaches, fever, or rash. Jaundice can occur because it affects the liver and manifests 5 to 10 days after the first symptoms. Acute illnesses subside up to 2 to 3 weeks, and some patients may even have very few symptoms and instead will experience unexplainable fatigue. Who is affected by hepatitis A? The clinical illness is more severe in adults than children. You can be diagnosed by a physician due to them finding that you have an enlarged liver or jaundice. Blood and urine tests will reveal a normal and low white blood cell count, mild proteinuria, and patients with jaundice. Treatment. Until patients are completely recovered, you do not want these patients having alcohol or sex with any people due to the risk of the alcohol affecting your liver and having sexual contact and giving it to others. Prevention. There is a vaccine available. It has become more common over the past couple years, and household members should also be aware and also be vaccinated. There are no really significant stats or facts about this. Hepatitis B is transmitted through infected blood or blood products, sexual contact, viruses that are presented in saliva, semen, and vaginal secretions. Primarily via sexual activity, with 33% acquired through heterosexual activity and 17% through homosexual activity. As I said earlier, the signs and symptoms are the same. I didn't find any signs and symptoms that help distinguish each one. They all usually present the same. Who is affected by hepatitis B? Over 44 million are affected worldwide, and I found that football players and sumo wrestlers are more likely due to the high contact sport and the sweating and the blood, but you really don't see that often now because there is a vaccine that is available and that most people do have. Diagnosis is the same. You can get blood and urine tests and have your doctor palpate your liver, see if it's enlarged, if you have jaundice, etc. Treatment resolves symptomatically within 4 to 8 weeks and can have a lasting sequelae. Again, they should not be drinking alcohol and they should avoid sex with other partners. Prevention, like I said earlier, the vaccine helps prevent this, and as well as if you are a member, if you're in the same house as someone who has this, then you should also have the vaccine and be aware. Some stats that I found is that chronic hepatitis B is a high risk for liver cancer, approximately 10 times easier to contact than HIV, and those who are affected with hepatitis B include 33% of those who have severe hepatitis and 5 to 10% who become chronically infected with the virus. Now moving on to hepatitis C. Hepatitis C is transmitted intravenously drug use, so needles, body piercing, and many sex partners. Injection of drugs is 60%, and multiple sex partners is 15 to 20%. It's needle sticks, you don't, just stay away. And there's also an unknown etiology. Signs and symptoms are the same. As I stated earlier, who is affected? About 2.7 million people are affected in the world. Diagnosis is the same as the others. Unexplainable fatigue, so you get referred to your physician. They can test you for enlarged liver, see if you have jaundice, blood and urine test to help bring out a positive test. Treatment is the same. There isn't really like a vaccine, but not many people really have it. Just for your prevention, you want to avoid contact with needles and sexual contact. Some stats and facts that I found is a high rate among patients with HIV, and it is the highest mortality. People who have this and HIV is about 30 to 50%. Approximately 50 to 40% of patients remain chronic carriers of the virus. Close to 20% of the chronic hepatitis C carriers will develop Crohn's over 20 to 30 years. I don't know if I said that right. And 2.5 will also develop hepatocellular carcinoma. Hepatitis C is also a nationally reported disease. And those are all the fun facts about hepatitis A, B, and C.